This used to be me all the time. Anytime I laughed or sneezed, I leaked. And I know that many of you are dealing with this as well, or worse. Hi, I'm Dr. Sandy Bavacqua, and I'm a PhD in molecular and cellular biology. I have a practice where I help women from around the world with their biochemical and structural feminine health issues. I want to share with you that I fully recovered from incontinence and organ prolapse naturally, without drugs or surgery. In my practice, I've come across so many women whose entire bladder, rectum, vagina, or uterus were literally falling out of their bodies. This is called organ prolapse. I've also met women with fecal or urinary incontinence that can't even leave their own homes out of shame and embarrassment. The only way doctors are trained to help these poor women is through surgery, prescribing medications, or sometimes recommending dehydration to help with the incontinence. One woman I worked with had 6 surgeries in 3 years to correct her prolapsing bladder. Yet after every surgery she became weaker and her symptoms worsened until she had several organs prolapsing and had developed both urinary and fecal incontinence. Then I found something really interesting. The pelvic damage that women endure often starts early in life, from falls, sexual trauma, hormone imbalance, or unrelated surgeries that can actually predispose them to pelvic pain syndromes and other pelvic floor failure later in life. There's a light at the end of the tunnel though. I took the time and I took my healing and professional experience and put together a first ever program called the Pelvic Health Transformation Program. And it supports women to recover their pelvic health naturally without medications or surgery. This program is not a Band-Aid. It's a guide to complete recovery and includes online classes where top practitioners from around the world have joined me to share their knowledge and their wisdom with you. We first address issues with the muscles that are under the pelvic organs. These are collectively called the pelvic floor. And once those issues are addressed and there's good balance that we've created, we can help women recover their entire pelvic bowl, lifting the organs back to their proper positions. Through education and easy exercises, we show you how to achieve your pelvic health goals. So by the end of the 9-month program, you will have created a strong pelvic bowl. We like to call that a pelvic bowl of steel. Here's the magic of this program. Each woman's situation, body, and history is unique, but so is this approach, and let me tell you why. I understand what you're dealing with. I struggled for 12 years with my own pelvic floor disaster, and I personally discovered that the cookie cutter approach didn't work for me, and it doesn't work for most women either. I found my way back to wellness, and then I created a program a few years back that is individualized for each and every woman so that your individual concerns and unique situation are addressed. We will work with healing your muscles and ligaments, realigning your organs, as well as attending to the subtle energies of all your tissues. You'll get videos, books, tools, and exercises, and you'll be able to attend live interviews by phone or computer where you'll be able to learn step by step from some of the top experts in this field. We'll meet virtually twice a month as a teleconference or webcast. Our office staff is available to help you get connected if you have any issues, but it's pretty easy. All you need to do is click on a link. You'll get live question and answer call time to support you throughout your healing journey, and you'll be a member of a private Facebook community where you could be supported by other ladies dealing with the same issues. Plus, I'm going to be there to help you. I'll be there to support you on the calls. I'll be addressing questions that are asked. You'll also get private one-on-one time with me. You'll also have the opportunity to be supported by a buddy, or if you want to work on your own, that's okay too. Perhaps you're not sure if this program is right for you. So first, what I'd like to do is offer you a free gift to help you determine if your pelvic floor is at risk. It's called the 20 Earliest Signs of Pelvic Floor Dysfunction. This is a gift I prepared for you, and it's going to help you determine if you're in danger of having pelvic floor failure. Or you may be painfully aware of an issue. If this is the case, I invite you to call my office to schedule a free 10-minute consult to speak directly with me about your concern. During our conversation, we can determine if the program's right for you, but I also like to help you get started right away on your path to recovery. Please feel free to pass this information on to others. We know that at least half of all women, young and old, have issues with their pelvic health. They may not have even determined this yet, they may not know, they may not have mentioned anything to you yet, but I assure you that you know women that are suffering or at risk right now. If you sign up, just to the right in the sign-up box, you'll receive the free gift I mentioned, and you'll also hear about free events regarding pelvic floor health, health for those who are about to be pregnant or have already had their babies, as well as in-depth education concerning female sexual health. So please stay tuned.